We have an opportunity in Vermont as a result of Irene to ensure that we rebuild this state better than the way Irene found us. That means residents get back into the homes, we get them back so much what they lost, that we grow jobs and economic opportunities by ensuring that Vermont's businesses don't get taken out by Irene. We also have a golden opportunity to ensure that we deliver to Vermont's most vulnerable citizens, our mental health patients in Vermont, the best quality care of any state in the country. We all know that the facility that we were using for the state hospital pre-Irene, the bricks and mortar, did not dignify or allow for quality recovery because the buildings were so dismal. As I've said before, if you took me as a happy, healthy Vermonter and placed me in the old state hospital, the quality of care was extraordinary and the building was so bleak that I would have emerged depressed if I'd gone in happy after 30 days of living there. That's why the federal government condemned the bricks and mortar of the facility. So we have an opportunity now. This administration has been working tirelessly with the extraordinary mental health community in Vermont, our community providers, our hospitals, our designated agencies, the Brattleboro Retreat, to come together with a plan that will ensure that we deliver quality mental health services to Vermonters for the next 100 years. That's our opportunity, and that's the opportunity that we're seizing today to outline the plan for the future. This is not about bricks and mortar. This is not about politics. This is about coming together, all of us, to ensure that we have one thing in mind. How do we take Vermonters who are struggling with mental health issues and get them quality, preferably community-based care, wraparound services, the support they need to ensure that they have a healthy and happy recovery. That's our goal. As you know, we've worked tirelessly to put together an interim plan given the fact that we had to leave the state hospital on short notice. Let's put it that way. I've made very clear that the opportunity is we will never go back to that facility. We must never go back. So here's the plan that we want to outline to you for the future that will ensure that Vermont is, in fact, the best state in the country to ensure a healthy and quick recovery, good quality care. We will build a 15-bed facility in central Vermont to ensure the good work that we've provided, the good quality care that we've provided by the state of Vermont for those that need intensive inpatient beds. That facility will be built in central Vermont, near Central Vermont Hospital. I'm going to ask the legislature to work together with my administration to get that building up, built, and opened as quickly as possible. We will begin by building a 15-bed facility because that's what we believe we need. However, it will be built and designed on a piece of land that is expandable and can be made larger when necessary or if necessary in the future. Why do we believe that we don't need more than 15 beds now? Because we've come up with a geographic distribution of services that we think will serve Vermont better than the model that we had in the past of one hospital in one location. That is the 15-bed facility that I just mentioned, very close to Central Vermont Hospital. The second is 14 beds provided by the Brattleboro Retreat. We also have entered into a partnership, will be, with Rutland Regional, and I want to thank Tom Hubner for being here today, for 6 permanent beds in Rutland. That will serve the Rutland community well as Bennington County and other communities nearby Rutland. We will have up to 5 beds, secure residential beds, on the campus of the Windsor Correctional Facility, which will allow us to serve patients there. That's the plan. 15-bed facility in central Vermont, built as quickly as possible. with expandable potential for the future if and when necessary. 14 beds permanently in Brattleboro, 6 beds permanently in Rutland, and up to 5 beds permanently Windsor Correctional Facility on the beautiful campus there that we have.